Hello everyone and welcome to Inside Healthcare. We begin with an in-depth look at what's being done to save the lives of new moms from one of the most common yet potentially deadly complications of childbirth. We're very pleased to have back with us Dr. Jed Gorlin with Memorial Blood Centers and Innovative Blood Resources. He is also on the National Council of Patient Safety in Women's Healthcare through its National Partnership of Maternity Safety. So Dr. Gorlin, glad to have you back with us.
Thanks for having us.
So maybe you can start off by what is the complication, and I understand that it's even on the rise, it's increasing in the United States and other countries?
So it's postpartum hemorrhage, which means bleeding after the baby is born, and it's the second leading cause of death from having a baby, from being pregnant in the United States. In many emerging world countries, it's the first and leading cause of death. In only 3 countries did the rate of maternal mortality increase from 1990 to 2010. That was Sudan, Afghanistan, and the United States.
Wow, why
and that's
is
a shame.
that? Why is it increasing?
Sadly, for a number of reasons, but the single largest one is probably access to health care. Those prenatal visits are important. And whatever one thinks about Obamacare, it is important that we increase access, especially for poor and minority women. It's among minority women that some of the highest rates of maternal mortality exist.
I just didn't hear that. I wonder how many women have heard about that and know about that. So what causes this?
So many things. Often after the baby is born, the muscle is very tired and relaxed. And in order for the bleeding to stop, that muscle needs to tighten up. That's called atony. And there are things that clinicians can do to improve that muscle tone, either by massage or by medications. But it's important that it's done in a setting where people can recognize the seriousness of that complication. It's also a little hard to know how much blood you've lost unless you've measured it. So one of the efforts that's involved is to encourage the quantitation of blood loss following baby's delivery.
Seems like such a simple measure too. How does the national organization, in your role, how does this all involved with trying to prevent this problem from happening?
So we're very grateful to Merck for Mothers. Merck Pharmaceutical Corporation donated a lot of money through the nursing organization AWON, and we've worked with 2 states and the District of Columbia, New Jersey, Georgia, and District of Columbia, to try to increase hospital preparedness for these bleeding events. And part of the biggest thing to have is just to do drills to be prepared for these events. So when they do happen, you can act very quickly, because you often need to act very quickly, be able to have good communication between the transfusion service and the docs, so that people aren't allowed to bleed to the point where it's too late.
And a new study has been published, or research has been published recently that addresses this and how to prevent it. What were some of the things that you found out?
So it's essentially a 13-step process of all the things that hospitals should do in advance to make sure they're prepared. There's surgical techniques, there's pharmaceutical techniques, there's just having drills that include all of the different participants. Very often when clinicians do practice situations, they will do it within their own group, but they won't necessarily be communicating with other groups, the emergency room, the operating room, or the blood bank, and it's important to include all parts in your drill.
Working as a team there. I read in the study too, like if every hospital, every birthing center did this, we could drastically reduce these complications.
So obviously not every bad outcome can be prevented, but at least there's an organization in California, CMQCC, that analyzes each and every maternal death, and somewhere between 60 and 90% of the maternal deaths, in hindsight, could have been prevented or likely could have been mitigated had action been taken earlier. Obviously, things are always clearer in 2020 hindsight, but that does tell you how much opportunity there is to improve.
So if a woman's watching this who's pregnant, what should she know or her family know about before she delivers her baby?
One, it's very important to have that good prenatal care and to have the people that are delivering you know you, so they know what's normal about you and when things aren't normal for you. That doesn't mean you can't have a baby at home, but if you are planning a home birth, you should have preparedness to know, great, if everything goes well, which it does the vast majority of the time, great. But if it doesn't go well, is there a preparedness plan? Is there a way of getting you to a place where you can have the proper care in a timely fashion?
And are there certain questions that they should be asking, like how do they know if their hospital birthing center are prepared for something like this?
Ask them if they have had a postpartum hemorrhage drill. Ask them if they've have processes and procedures in place to know what to do if they start bleeding a lot.
What else should women know about this?
Well, they should be aware of just how safe the blood supply is and not be scared if they do need a transfusion. Getting a bad infection from the blood is about the last thing they should be worrying about, because we are so good at being able to screen blood. It's really quite safe now.
And as a blood donor, I'm well aware of the screening. I mean, it's very thorough and you should feel confident about it.
We ask lots of questions every time, but more importantly, we do lots of testing every time. And so even if it's a little annoying that the nurse asks you your name for the 5th time, that's their job, and you really, really want that proper identification. That's to keep you safe. They're not doing it to annoy you.
If someone wants to get more information about it, where would they look?
As far as
Or
postpartum hemorrhage,
yeah.
both the doctors organization, ACOG, ACOG, and AWON, which is the nursing organization, AWHONN, are excellent sources of information. The Merck for Mothers Project, again, just look up Merck for Mothers Postpartum Hemorrhage. There's a lot of information there. And for donating blood, Memorial Blood Centers has lots of information on how and why it's important to donate, especially in these midsummer months when a lot of people are on vacation and it's a little harder to keep our shelves full.
It is. It's really important to remember that. Is it because more accidents are likely to happen during this time of the year, or?
Actually, blood is used reasonably constantly year-round at a trauma center like Hennepin County, where I also work. We obviously see more trauma. People are riding more motorcycles in the summer. But the challenge is a lot of the blood drives we would have at schools, colleges, businesses are very hard to do during people's peak vacation times.
So it's important to give if you can.
Blood is used constantly. Cancer doesn't take a vacation.
Well, this has been really good information, and we really appreciate you stopping by to tell us all about it. Thank you.
Thank you so much.
Good to have you back with us. And that leads us into, coming up next, we're going to talk about some of the most common summertime injuries. So stay with us, everyone.
Look at you. You're at the top of your game. You're unstoppable. Nothing can throw you off track. Wait, is that your car? Uh-oh. Yeah, I saw that coming. That will throw you off track. You're looking at around 10 grand in fines, legal fees, and increased insurance rates. Let's try this again. Smart move. Because buzz driving is drunk driving.
Did you know that burns are some of the most common injuries doctors see during the summer months? For advice on ways to prevent these injuries, we're pleased to have back with us Dr. Michael Bryant with the Urgency Room. It's always a pleasure to have you with us. So
Thanks for having us.
So maybe we start off with sunburns, maybe? I don't know. Advice on, sunscreen. What kind? How much do you use? How often do you put it on?
Sure.
Things like that.
It's beautiful weather today, and we're having those high heats. And us being Minnesotans, most of them are Scandinavians. A good percentage of people have that light skin, and we call it a dose of vitamin D today. But surprisingly, people think that more SPF is greater. So should I have 50 or 100?
No, I guess you're saying.
It turns out there's no real harm in having the higher SPFs, but 15 would be about 94%. And if you're sort of a darker skin type like mine, that would be fine. But more the lighter skin types need at least a 30. And then the question is there really anything that's waterproof? And being sort of an emergency dermatologist, I'd say no, there really isn't any. So reapplying anywhere from 30 minutes to 2 hours. I think every 30 minutes reapplying is kind of tedious. One of the things I was thinking about, well, what about babies? You know, we take care of a lot of babies at the urgency room, and we don't want to be seeing them necessarily for sunburns because it can be dangerous.
Imagine, yeah.
And in general, we recommend that anyone under 6 months old, you just keep them out of the sun, keep them covered, and then after that, you know, applying sort of those baby safe ones that sort of would be on the higher end, but a 15 would not be enough for a baby. That's like 94% of the UVB, ultraviolet rays. It's UVA and UVB. The UVB are the ones that cause the sunburn. So that if you go to 30, you're at 98% coverage, and that's pretty good.
As an outdoor biker yourself, you're probably putting that on quite a bit then, right?
I need to.
Yeah.
I need to be.
Even
I
with
do
the
get
darker complexion?
Yeah, I try to put that on, especially those really sensitive areas, the nose, cheek, ears, that you often don't think about that. When people you see them putting on sunscreen, they're putting it on their arms or their neck or something like that. But those areas that are prone to skin cancer are really the face and the
Really?
hands, and we sometimes forget that. One of the things that people say, well, doctor, I'm on a lot of medicines. Am I at risk for sunburn? And truthfully, you are.
So what do you do then?
You really need to be quite proactive, and to a degree, I say, you brush your teeth, put on some sunscreen at the same time, so you at least have it some layer going on. But particular things to look out for are antibiotics, heart medications,
Oh, wow.
cancer
Common
medications.
things that everyone uses. Yeah.
And so, what if you get a sunburn? How do you treat it? One of the things that sort of decreases that inflammation, and your skin is upset, it's inflamed. Anti-inflammatories like ibuprofen or naproxen, they're really good for treatment, but some folks take those every day, and those are actually photosensitive medications, so it's hard to be doing the right thing. But you really want to check all your medications, and your pharmacist is probably your best expert, but most of the packet inserts will say, this is a sun-sensitive one, but the antibiotic that's really known for it would be a sulfa antibiotic, antihistamines, and then the anti-inflammatories.
I can't tell you how many times I've had people say, well, it was cloudy out. I was surprised I got burnt.
Yes, those ultraviolet rays do come right through the clouds. And so no matter what here, you really need to be doing it in the summer and fall and winter, all year round. We really need to be protecting our skin.
And I would think, too, with all of our lakes and rivers, that you get that reflection on the water, double the whammy.
Magnifies it for sure. Yeah, one of the things that people say, well, would you really see sunburn in the urgency room? Would an emergency doctor really treat that? And sometimes it can become quite severe with blistering, and there's times where we might use more than just over-the-counter medications. And if you've got blistering or severe pain, that'd be something that you could come to the urgency room. We do really well at treating pain and sort of advising for management of that. The thing that we also want to think about is it really sunburn? If it's you've been outside at the beach all day and then you're burned, that's one thing. But if you have just one leg that's red and hot and maybe you have a fever, that could be an infection. So if it seems out of place, it'd be something that you'd want to come have us check it out.
I know years ago my sister, who was even fairer than I was, just really light skin, blonde, blue eyes, and we were on a lake, and we knew she got a lot of sun, but like the next day, she was just puffed up her eye. And we did go to the emergency room. And
yeah, so one of the things that you can help treat it is also making sure you're hydrated. So sunburn, thinking about burns, we really want to just take this opportunity to talk about heat illness and heat prevention. And the best thing you can do for that is make sure you're out of the sun when you can be. But if you're going to be out, make sure that you're getting a proper amount of fluids in there, and that people at extremes of age, young ones and the old ones, they don't have quite the reserve.
Okay.
And so that if you're on diuretics or water pills or things like that can put you more prone to dehydration, they're going to make it harder to recover from something like a sunburn or a heat illness.
And I thought I read too that if you're thirsty, you're already dehydrated.
Yeah, you're behind.
Yes.
You're behind. One of the silly things that I say is that for people who aren't on diuretics, you want to make sure that you have to use the restroom every few hours, because that's sort of your body's gauge to say, yeah, you've had enough fluids.
Good idea, yeah. Especially if you're in that heat, because sometimes if you get that heat exposure, you may not be able to feel the temperature and stuff.
Right, absolutely. And then if you stop sweating, that's extreme, and you really need to get cool.
So what kinds of signs and symptoms should a parent or a loved one be looking for on someone, like their child or their loved ones too, on what are some signs that they've had too much heat or too much sun?
So you're not urinating, you're not sweating, lightheadedness, or fever. They're feeling feverish. In extreme cases, you can have a heat illness or heat stroke where there'll be confusion or seizure, but the majority of us are going to feel ill enough that we're going to go inside. Radiant heat, is that direct sunlight, but those days where you really need to be cautious are when the heat is high and the humidity is high, because that really compounds the amount of heat. They call it a heat index or the dry bulb heat, something like that.
So get them out of the sun right away.
Yep,
and
cool
get
them. You can put cool rags on them. They talk about, for severe cases, in the emergency department, we might pack someone in ice. We might put ice in their axilla or in their groin or sort of on the chest area to help cool them rapidly. Getting wet, evaporation is your best key, and that's why when you're not sweating, your chance of getting heat illness goes up rapidly.
And when in doubt, seek emergency care.
Absolutely, absolutely. Another burn we might talk about is fireworks season. How do I prevent fireworks injuries?
Yeah, it seems like 4th of July continues all month, it seems like, at this time of year.
The statistics say from June 19th to July 19th is that hot time, and approximately 10 to 15,000 people across the country will go into the emergency department with injuries.
Wow.
The best advice is let a pro do it. But if you're like me and you're a firework freak or you love fire, you just want to be careful, do things that are smart. Wear gloves when handling things like that. Keep your distance. If you're going to be around fireworks, it's a really good idea to wear eye protection. It's one of the common injuries that we see people coming in to the urgency room with is either a chemical exposure or a foreign body in the eye, and you really want to do your best to protect those.
Right. Yeah, my brother-in-law, it's like my whole family here. My brother-in-law, he got a really bad burn like last year from fireworks that kind of, just kind of shot at him and he caught his leg, and he still has a burn there now.
Yeah, those things burn really hot. Just a sparkler burns at 1,200 degrees.
That's incredible.
And think about, you're boiling water at 220. If that splashes off the stove, like, oh, that's a terrible burn. But here we act cavalier with these fireworks that are at 1,200 degrees. So we really just want to use caution. They're not a thing for children. If children play with them, they're going to be my patient, and I prefer that you enjoy the summer not as one of our patients.
That's for sure. And then also we see a lot of bonfires at this time, or campfires and things.
Yeah, absolutely. Having that common sense of have a safety ring, keep kids at a safe distance, but think about things that are going to enter the fire. A child falls into the fire, so you're going to have a safety area around it. But then things that might come out of the fire, sparks, pieces of wood. Actually, my son has a burn from a marshmallow. Those marshmallows get just as hot as the fire,
They do.
and it became liquid and fell on him. And so what happens if you get burned? How do you know to come in? So we used to talk about first, second, third, fourth degree burns, but really now we talk about,
the
is
difference.
it superficial, is it a partial thickness, or are we worried that it's a full thickness? And a trained emergency specialist like myself at the urgency room, we can tell you when it becomes blistered, now we're thinking about partial thickness, and it's something that you should come in and see us and let us help you determine how best to treat it, how to heal up. And often it's really wound management and then specialty referral to like a burn center. But that initial assessment is really done by a specialist in emergency medicine.
Final advice for our viewers out there about staying safe and preventing these summertime injuries?
Get your vitamin D, enjoy the sun. When you're out there, before you get out there, put on some sunscreen, and then just practice some safe habits. Be safe around the fire, enjoy your families. And if you should happen to have a severe burn or concerns, feel free to come and see us at the urgency room.
Sounds great. Always great to have you with us. Thank you, Dr. Bryant.
Thanks for having me.
Thank you. And still ahead, is your town one of the most livable communities around? We'll find out when we come back.
Todd's a great guy. I mean, look at him. What a sweetheart. Attaboy. Wait, Todd, what are you doing? How totally selfish and un-Todd-like of you. Come on, Todd. Come on, man.
Now we turn our attention to what it means to live in a livable community and how you can find out how your community ranks. And joining us to explain all of this is Jay Hapala with the AARP Minnesota. So glad to have you with us.
Yeah, thanks very much, Jody. Glad to be here.
So what exactly, tell us all about maybe just about the AARP Livability program. What's that all about?
Yeah, well, Livable Communities is an initiative from AARP, really in response to the fact that we all know the baby boomers are aging, right? And our mission is to enhance quality of life for us all as we age. there couldn't be much more that affects our quality of life other than the neighborhood that we live in. So we
Really?
think that's
It goes down to that much?
Yeah, most definitely. So in response to our aging population and the impact that their neighborhood has on their life, AARP has created tools, and we've done research that can aid individual citizens. It can aid policymakers and municipalities in planning for communities that enhance that quality of life for us all as we age.
So what would be some of those criteria that you look for and for the ranking system of if you live in a livable community or not?
Sure. So I think we can imagine that how do we spend our time on a daily basis at our homes and using transportation, being engaged in our communities. HealthCare is a major impact. It's an aspect of the livability of a community.
So if you have barriers to transportation and you live maybe more in a rural area, that could be an issue if you're elderly or older population?
Yeah, when it comes to issues like transportation, I know we were able to identify those aspects of a livable community based on research with AARP's membership. So we surveyed thousands of our members to find out exactly what are the aspects of their communities that are important to them. So that's how we came to understand what that is. And then what we've done with our livability index is taken research and metrics from 40 different sort of research studies or demographic surveys conducted by the U.S. Census, conducted by the Department of Housing and Urban Development, Centers for Disease Control, and we've created an index based on the scores of the neighborhoods all across the United States of America.
I was going to ask if it was just, we're taping this here in Minnesota, but it goes on YouTube so it can be seen by people around the country then.
Right. It's an interactive map, so people can type in on this website, they can type in their address, and it's going to show them on a map in addition to some information about the index. So the comparative value of the livability of their community based on 7 different factors that our members find to be important. Like I said, transportation, housing, engagement. The engagement meaning the ability to have social connections in your community. The design of your neighborhood. Is it easy to
So
get
it isn't just like your community at large, it could be right down to like your street?
Right, yeah, a block group. So a block group within a municipality or within a zip code, for example.
So one of the communities that carries our program is White Bear Lake. You were saying that you could use that as an example.
Yeah, so White Bear Lake has a relatively high indexed livability score. At the top of its list would be housing. So relative to other communities across the United States, housing in White Bear Lake is affordable. It is accessible, and there are multi-unit housing developments at a higher rate than other places across the country. So that's just one example. But if you compared White Bear Lake to, say, Maplewood, transportation is, technically, or we were able to measure it as being more accessible and flexible than it is in somewhere that's a little bit farther out from the city center like White Bear Lake.
So if you have, it's great if you got a higher number, you can feel good about the place that you live, but what if you don't have a higher index number? Then what can you do about it?
Yeah, sure, that's a good question. I think we created this tool for policymakers, for individuals. So if I was looking for a place to live and housing was important to me, I could use this tool to find the type of housing that I was looking for, but also for citizen groups. So I know across the country, cities and here in Minnesota, cities are working with citizen groups who want to influence change. So this system, the AARP's Livability Index, can be a starting point for these civic groups that are working on it. They can look at the score for the neighborhoods in their city and realize if they're doing pretty good when it comes to housing, while maybe they have a lower score when it comes to health and access to healthcare or the affordability of healthcare, and they might have an initiative to work on smoking in their community. They might have an initiative to work on obesity in their community and make it a better place to live.
And obviously with AARP, it's aimed at 50 and what's the younger or something like that. But this would apply to anybody, any age
Most
group, any
certainly.
families and stuff like that.
Most certainly. What we know is that our population is aging, and that's just the reality. People want to stay where they live, so they don't want to move to a retirement community. They want to stay in their homes. They want to be where they live today. But when we create communities that work for older adults, we create communities that work for everybody. So
if someone wants to find out about, again, specifically how their community, how their street, how do their index, what do they do?
yeah, it's a website, and it's very simple to use. The URL, or what to type into an internet browser, is www.aarp.org and then /livability index. So that's how you get to the tool where you can type in your address. If you just want to learn more about the research we've done on livable communities, it's aarp.org/livable communities. So easy to remember.
Final comments for our viewers watching.
Yeah, I think there are a lot of possibilities for us. People are excited about their local communities. People are, we hear so much about this, support your locality, go local, right? And people care about where they live. They can get involved. They can work with AARP and our network of age-friendly communities to, be on the cutting edge of what it takes to build a great place to live.
Well, Jay, it's been great to have you with us. We'll have to
Thank
come
you.
back, talk about some other topics of interest with health and medical for our community.
Yeah, absolutely. Thank you.
Thanks, Jay. And we'd like to thank you for joining us. We hope you're back here next month on Inside Healthcare. See you then, everyone.